Hi, Neota.
Hello, Miri.
We're talking about what we expect when we're treating pain with hypnosis. So,
Yeah.
just, just to remind everyone that both you and I are hypnotherapists,
Yes.
and we work with chronic pain after it
Yeah.
was medically diagnosed.
After a diagnosis has been achieved with a doctor, because we cannot turn off the message if the signal hasn't been correctly applied. Pain is a message. It's a signal that there's something wrong, and we have to know what that physical um, ailment is and have it be treated. And then we can treat the emotional component with clinical hypnotherapy that has contributed to the beginning or the severity of the physical pain.
Absolutely. So, what what do you see when someone, or what do you notice when someone comes to your office or having Zoom call with you about their pain? What is normal to see?
Well, people will contact us to deal with like migraines or fibromyalgia or IBS, right? Irritable
Mhm.
bowel syndrome is very painful. Um, there are all kinds of aspects of, back pain, chronic back pain, or um, sinuses. And so I I will just help my client to talk to their subconscious mind about what the pain is signaling emotionally. I let the doctor decide, the physical um, relief, the
Mhm.
physical ailment, and the treatment for that. And and what I do with hypnotherapy is a complement to that. So I find out what the emotional component is to that pain. Now, I've been sort of dancing around it, but I have my own ideas about what the contributing pain is because of Louise Hay and You Can Heal Your Body, but it's not 100% accurate, and it's only an idea. It's only something to investigate, but the subconscious knows. So it doesn't matter what the book says. It doesn't matter what kind of treatment's happening from the physician. Your
Mhm.
subconscious knows what the wound is emotionally, and and then I know how to help my clients heal it in a session of or sessions. Depends. Each case is different.
So last time we talked about the underlying layers under the layers that are underneath the pain, and this time we want to talk about what's happened and how hypnosis can help, right?
Yes.
With the pain and what we can see. And it's common to see, it's not always happens, but it's pretty common that the pain at the beginning will come a little bit more severe.
Right. Right. It's like you're taking something and you're shaking it up and agitating it. And as you agitate it, of course, it's like how any wound, as it starts to heal, even if have a cut, as it starts to heal, it gets a little bit worse, as the immune system gets to work on it. So it'll intensify and get, uncomfortable. It'll get
Right.
uncomfortable. And
Right.
then and then it starts to really heal.
Yeah, because it's like touching the wound
That's right.
and
That's right.
irritating it, and
Yes.
and then it's uncomfortable. Uh,
Yes.
and then we see some kind of movement, some kind of shift that is happening. Sometimes it's for the best, sometimes it's for the worst, but we see a movement, and any movement is good
Is
because it means that something is moving,
it
something is
makes yes, it's proof that there is something happening.
yeah. So when someone is coming to see me for pain, I tell them, note that it might be that you feel uncomfortable after the first session, but it
Right.
will be okay.
Yes. Yeah,
And sometimes it doesn't have to be like this. Sometimes they feel good and
that's right.
something else is moving. Any emotional piece is moving rather
Yes,
than physical. But, you know, this is something that we might expect.
absolutely. Yeah,
Um, Another thing that we would like to do when we treat uh, pain, chronic pain with hypnosis is to remove the suffering from the pain. Yes, it's painful. Yes, it's uncomfortable, but you don't have to suffer.
that's right.
And this is basically a change of perception.
Yep.
And so IBS that you mentioned
Yeah.
often leads to, you know, people staying at home
Yes. Yep.
and missing out on many, many things like theater or hanging out with friends, going to restaurants, of course. Um, but once you're taking out the suffer, out of the pain,
Yep.
now you can go out with friends. Now you can
That's
look at the situation differently. Now you can go to the theater. Now you can go for a walk. Maybe not 10K, but you might expect to have some discomfort in a certain level, but it's okay. It's not, you're not suffering. It's a pain, but this is all it is.
right. Right. Manageable. Getting it to a manageable level.
Yes, absolutely. So change of perception.
Yes. Yeah.
Another thing that we have here is the fact that you can start being comfortable with the discomfort.
Right. Right. Just
Yes,
acknowledging it and being patient and and allowing it to exist before giving it permission to release. And just
yes,
feeling that, letting yourself acknowledge it, the
yes,
power that comes from that, right? From having your story and sitting with it, allowing it, not with a shame, not with judgment, but with compassion and empathy.
and I
And
think this
again,
is it,
changing that
right? The
perspective.
compassion part of it.
Yeah, yeah,
Mostly because it's happening for a reason. There is a reason why it's painful.
yes. Yeah,
Um,
it's a message. It's giving you a signal to something important, something
yeah,
that
so
is
if we
worthy
listen
of
to
you.
it,
Sorry?
go ahead, go ahead.
No, you say.
So I said, if we listen to the signal, if we listen to what it has to say to us, then it makes it easier for us to say, okay, this is it. Okay, I understand. So it can be, it brings up a trauma that we had before. It brings up, work overload. It brings
Yeah,
out stress or anxiety or guilt or
yeah,
anything. So, okay, now I understand why the pain is here. So now I
yeah,
can sit with it. Now I can feel the discomfort, but then I know I can release it.
that's right. It's just accessing the the emotion that it is tied to, whether that is historical, like something old that has been unhealed or trapped, or if it's something that's currently going on that is just a new situation that just needs to be dealt with. And just letting your subconscious knows, it knows what the problem is. And as hypnotherapists, clinical hypnotherapists, we know how to find that answer. And
Yes,
from there we know how to go about reframing your perspective and releasing the need for it. It's very, very powerful.
yes,
It's amazing. I love helping clients from here to there. I love to help.
yes. Reframing is like acknowledging, right? It's like understanding the message and
Yeah.
reframing it to give it a different meaning
Yep.
is very powerful. Um, So we talked about understanding the message of the pain and what it brings with it, and also acknowledging that the pain itself, if we are suffering and we feel the pain even more pronounced. Like the pain will be stronger if we are bringing the suffering into the pain.
Absolutely. Absolutely.
So yeah, it's not easy to separate.
Right.
Sorry,
Bless
but
you.
thank you. But it's it's worth doing it. It's worth
Yes.
going through separating the pain and understanding what you can do and enjoy from what you can do rather than to soak in suffering and
Yeah.
misery
Yeah.
and pain. So this is another big thing that I believe um, is worth doing and worth working towards, and this is exactly what we do. Um,
Yes.
when we work with someone, we are going to the subconscious. We are the beginning is to understand the message, to understand what's the benefit, like what's the message coming from this pain. And
Right.
then once we understand it, everything is moving, is shifting. Sometimes it's more painful for temporarily more painful. Sometimes it's, a great relief. Um, and then the relief continues. But understanding the message, I think, is very important. And this is what we're doing in hypnosis.
Yeah. And I mean, the power of the subconscious mind, right? The power of it is phenomenal. And so it's going to continue um, supplying the pain that it's doling out for its specific reason until you address it. And I mean, first of all, the subconscious is responsible for creating the pain, but it also holds the key to releasing it. And I truly, truly believe that using your subconscious to ease your medical conditions is the most understudied and underutilized aspect of our entire health system because the reality is placebos work, meaning the power of your mind has the ability to heal your body. So I'm not saying that that's what I can do or that it works every time, but I'm saying it's possible. It is proven in medical journals. It is proven that placebos work, meaning the subconscious is that freaking powerful. And we have the ability to be participants in our healing in conjunction with the medical system that we have in place. And using hypnotherapy as a modality to deal with pain and illness and ailments is so underutilized. I mean, we may not be able to help everybody out of pain completely, but why not try?
But we can co-create
Oh, for
the
sure.
solution. And hypnosis, it's about co-creating, at least the way we
Yeah.
see it.
Yeah.
Another thing that we are doing is strengthening the mind and body communication. And
Yes.
they always communicate, but we want it to communicate in the way that we want it to communicate.
Yes. Yeah. For good, for benefit, not as
Yes,
punishment or not as a signal, but to enrich and empower.
absolutely.
Self-love, inside and
So,
out.
yeah, and compassion, lots of compassion.
Yes.
When I work with people who suffer from chronic pain, we see lots of anger, frustration,
Yeah.
and impatient, of course,
Yeah.
and often self-hatred, sense
Yeah.
of
Yeah.
failure. The body is failing us.
Yeah.
And when we can shift this into compassionate
Yes.
relationship with our body, because this is the only place where we can live, right? And for bad and um, for good. So we want to make the experience good and pleasant and positive.
Yeah,
So this is another thing that we need to remember. The body is not failing us. It's what's happening to the body that we can
that's right.
change and create a new relationship with our body.
Yes. Well said.
So
So
how
if
can
somebody
people, yeah, go ahead.
if people are suffering with chronic pain and they want you to help them, how can they reach you?
So I'm Miri Malkin, clinical hypnotherapist and motion code practitioner, coach as well. I'm in Vancouver, BC. I see people mostly online all over the globe. And my contact information is down below, and I'm happy to answer any question. And what about you, Neota?
I am Neota. I am a clinical hypnotherapist in Nanaimo, British Columbia. I see clients in person here and I see clients online for sessions anywhere in the world. And I also do handwriting analysis. I am a laughter therapy practitioner and clinical hypnotherapy. And again, my contact information is also included in the notes. And so that concludes
Absolutely.
another episode of Hypnotic Talk with Miri and Neota.
And if you have any questions, feel free to contact us. We'd love to answer any question.
Indeed.
And until
And
next time, bye bye.
bye for now.